Welcome, everybody. Welcome to the presentation of the MENA Economic Update, organized by the Policy Center for the New South in partnership with the World Bank, which is publishing the report. I'm Ivan Martin. I will be facilitating. I'm Senior Fellow at the Policy Center for the New South, and I will be facilitating the launch presentation this afternoon in Africa and Europe, and this morning in America. For this presentation, which is what I would dare to say is the most authoritative report on current economic developments in the MENA countries, Middle East and North African countries. We have three of the authors. We have the team leader, Rachel Juting, who is going to make the main presentation. We have Roberta Gatti as well, who is the chief economist for the MENA region at the World Bank. And we have Ha and Yuyin, who is another one of the authors of the report. And then we have three discussions from the think tank and research world. On the one hand, we have Leila Baghdadi from Tunisia, who is professor of economics and currently also member of the board of governors of the central bank in Tunisia. We have Mohamed Hamdawi, who is a senior fellow at the Trends Research and Advisory company. And we have Yuri Dadus, who is senior fellow as well of the Policy Center for the New South and has been also very much involved in his professional life in the World Bank. I won't make any more presentations. You have the biographies of all speakers and discussants in the agenda, and I will just give the floor to Roberta Gatti for her introductory remarks. Roberta, the floor is yours.
Thank you, Ivan. And let me just say what a pleasure it is for me to be here today in such distinguished company and with such a interesting discussion ahead for us. I will limit my remarks to just a few points. The first one will be to try to frame the picture that the semi-annual MENA Economic Update paints for the region in the bigger picture of the current recession and then recovery from the pandemic. I will then move on to just say a few words about the structure of our report. This is a semi-annual report with a very tight timeline of every 6 months, which is has a double soul, part macro and part a focus of interest. And then I will move on to just highlight some top-line messages from the report, which then my colleague Rachel Fan will discuss in much more detail. So let's start with the big picture. I guess it's not news to all of you that this crisis has been a collective setback on many, many fronts. The first one is that this has been a shock that has been regressive within countries. And so if we look within, we know that this crisis has been affecting the most vulnerable, the young and women, in part because of the structure of the lockdowns and the sort of social distancing that have affected the most face-to-face activities, which tend to employ the most vulnerable, in part also because some of these vulnerable groups are more difficult to reach with social protection policies to sustain them. Finally, the most vulnerable tend also to be the ones who have less human capital, which is an essential asset for people to bounce back. However, if we look at the macro picture, this crisis has been regressive also across countries. And we're coming from 2 decades of poverty decline. We're coming from 2 decades of decrease of cross-country inequality, admittedly, thanks to China's growth and the East Asia and the Pacific countries' performance. But now this inequality is increasing. Just like a couple of statistics, just to give you a sense. And I think that there is a paper coming out from our chief economist, Carmen Reinhardt, and some of our co-authors that will get in much more detail about this. But in 2020, 90% of 196 countries had a decline in GDP. And this speaks to how wide sweeping and sort of correlated across the world the crisis was. If we look across advanced, mixed, and LICS countries, 41% of advanced economies have now GDP per capita that is above 2019, but this number goes down to 27% for mixed and 23% for LICs. Maybe the future growth in 2022 will turn these things around. We're hearing already speak of a sort of rotation of growth, but at the moment, this is where we stand in 2021, in a regressive crisis within and across countries. This regressive crisis is folding back many of the gains that we saw in the past 20 plus years. One of these gains was the decline in poverty, and this is the first year since 1998 where we see an actual increase in poverty. And Rachel will probably tell us a little bit also about the numbers that we have for our region. This is also a moment where we see large fiscal deficits that have emerged globally and probably the highest increase in public debt in just 1 year due to the response to the crisis. I'm sure that all of those participating to this room are very attuned to the debate that we see now on inflation. It's rising. The question is whether it's a transitory or a permanent phenomenon. But overall, if we look at short-term effects, they all paint a picture of significant concern. Of course, there are also the sort of long-lasting consequences. And if we start talking about human capital of children, if we start talking about consequences on health, there is a large agenda out there for countries, not only to think about recovery in the moment, but also to build the basis for a long-lasting, I think it's been called building back better, but sort of trying to mitigate the impact of the crisis and sort of set the basis for a more resilient future. Now, this is the big picture in which the picture of MENA unfolds. I said that I would have said something about the structure of our report. It's a modest report. We produce 2 a year of these. And so we tend to rotate teams producing these reports because the timeline is extraordinarily tight for us to produce reports that are based on the macro side, on the macro estimations produced by country economies. So a big chapeau and applause to them because they are across the whole region, and then on a spotlight that is chosen every time. And this time around, when we started to think about health, we couldn't think about anything else. Now, having told you that this is a report that we produce rapidly, I also want to set the expectations about the depth of the analysis that you will find about health. But I also would like to highlight the strengths of what we do, which is to try to connect the picture of health systems with a macro picture. Admittedly, it was an easy job, sadly, for us to do so, because never like today, we see direct mapping between what happens to health to what happens to the macroeconomy. And it didn't used to be like that. For us, formerly microeconomists, it used to be very difficult to find clear evidence, causal evidence of productivity impact of health. But right now, we see it unfolding under our own very eyes. Now, when we started looking at this question of health systems in our region, we sort of outlined 3 key messages that Rachel will discuss in much more detail. On the economic side, we highlight the fact that in MENA, a decade more of sort of truncated reforms towards a market economy have saddled the region with large government spending, increasing public debt, particularly for oil importing countries, and an underfunding of core public health functions. So that's the first finding that sort of sets MENA systems as being underprepared to face such a dramatic shock as the pandemic. The second one is looking on the demand side, on the type of burden that these systems face. We remark the fact that, this is a young region and this is for sure an asset, but this young region is surprisingly more sick than you would expect. And actually statistically, you see that once you adjust for age, morbidity of the non-communicable side before the pandemic hit was already quite high. This part of the picture paints a story of potentially underfunded supply, potentially high demand and stress on systems. And when we look at the awareness of policymakers about where do we stand, we find evidence of over-optimism. And that's where the title of our report comes from, overconfident. We find evidence that policymakers were on average over-optimistic about the preparedness of their health systems to face a pandemic. Clearly, a stress like this is unprecedented, and every country and every region struggled. But MENA struggled in its own particular way. Now, the work is the collaboration of a large team that sits both in the Chief Economist Office of the MENA region, but also in DEC, in the health team, and also a collaboration with all the country economists of the region. So on this note, I would like to pass on back to you, maybe Ivan, and then to my colleague Rachel for the real deal. Thank you.
Thank you very much, Roberta, for framing these introductory remarks and for framing both in terms of global economic trends, in terms of the process of producing this report and the main focuses on health systems and state expenditure that you have chosen this time. I haven't said it before, but the report, the MENA Economic Update, is available online. You have just to look for it on Google, and you can easily find the full report and a press release if you are interested in it. And then I will give the floor to Rachel Juting, who is the team leader of the team of authors of the report, and who will make a presentation of the main contents of it in maximum 20 minutes. Rachel, the floor is yours. Thank you.
Many thanks. I hope you can see my screen and you can hear me.
Perfectly well.
Good. Okay, so thank you very much, Roberta, for the very kind introduction. And good morning, good afternoon, and good evening, everyone. I want to thank Policy Center for inviting us and for organizing and hosting this event. Many thanks to everyone who joined us here today for your interest in our report. This is my great pleasure and honor to be here to present to you our semi-annual flagship report, MENA Economic Update, October 2021, Overconfident, How Economic and Health Fault Lines Left the Middle East and North Africa ill prepared to face COVID. This report is produced under the strong leadership of Roberta Gaddi, whom you just met, and intellectual guidance from Daniel Letterman, the Deputy Chief Economist. And I'm also proud to have as co-authors Arian Hatafe, a Senior Health Specialist and a medical doctor, and Ha Ming Nguyen, a Senior Economist who just joined us today, and Anya Saltman, a Research Economist, and Joseph Martin Sachs, a Master Candidate, and Christina Wood, a Senior Economist in our office. The report couldn't be done without extremely hard work from each and every one of them. So here is the roadmap. We will start with GDP forecast, followed by long-term socioeconomic trends that left MENA with overburdened public health systems. And we will introduce ill-prepared and overconfident health systems prior to COVID-19. And then we'll discuss how the system is overwhelmed during COVID-19 and close by data transparency and policy recommendations. So the World Bank forecast that the region's GDP contracted by 3.8% in 2020, and we expect it to grow by 2.8% in 2021. We show the development in GDP in terms of GDP levels, as you can see in the solid black line on the left-hand side chart. Built upon the negative GDP growth of 2020 for MENA, even with a positive growth of 2.8%, MENA would still be below its 2019 GDP level by 1.1 percentage points. As you can see that the black solid line starts at 1 in 2019 and couldn't rebound to the horizontal line of 1 as of 2021. As a rough approximate of the economic loss from the pandemic, we compare the latest forecast, namely World Bank forecast October 2021, with the latest forecast vintage conducted before the pandemic, which is the World Bank forecast October 2019, during which we have forecasted consecutive positive growth more than 2% for both years 2020 and 2021. Based on that forecast, we depicted what the GDP levels would have been in a no pandemic scenario in the dotted black line in the left-hand side chart. As you can see, this dotted black line starts in 1 in 2019 and climbed above 1.05 at 2021, indicating a more than 5% increase in GDP levels compared to 2019. The difference between the GDP level in 2021 in the pandemic scenario, which is conducted in October 2021, and in the no pandemic scenario, could be our approximate of the economic loss due to the pandemic. It's around 7% of the 2019 GDP, which is almost 200 billion USD. If we decompose MENA region by country groups, we can depict GDP growth for each groups on chart on right-hand side. As you can see, red lines represent GCC countries, orange lines represent developing oil exporters, and blue lines represent developing oil importers. So GDP growth for 2021 is forecasted at 2.6% for the GCC, 3.2% for developing oil exporters, and 2.8% for oil importing countries. The distance between the dotted lines and the solid lines indicate that all three groups will suffer economic loss compared to the GDP level that they could have reached in a no-pandemic world. Morocco has the highest GDP growth forecast in 2021, 5.3%. It's led by a low baseline effect and a very strong growth in the agriculture sector. Morocco also has a high vaccination rate at 44% of the population as of mid-September. I just checked last night, it's almost 60% as of now. That being said, what we care most is the level of GDP per capita. Compared to GDP, GDP per capita is arguably a more precise measure of the region's standard of living. Since the population in the region also grows by 1.6% in 2020 and 1.7% in 2021, the growth in GDP per capita is smaller than the growth for GDP. Based on the most recent forecast, the region's GDP per capita is forecasted to grow by a mild 1.1% this year after a contraction of 5.4% last year. As you can see from the solid dark line on the left-hand side chart, compared to 2019 income level, which is shown as the horizontal line of 1, the region's income level in 2021 is still 4.3% below. And similar as before, we depicted the forecasted GDP per capita level in no pandemic scenario in the dotted line on the left-hand side chart, which is based on forecast of GDP per capita conducted in October 2019. Compare the end of the solid line and the end of the dotted line, we see the economic consequences to per capita income level amounts to around 7%, which will be reflected in an increase of the poverty rate. If we zoom into the three country groups, the level of GDP per capita is depicted in the chart on the right-hand side. For year 2021, the growth in GDP per capita is forecast at 0.3% for the GCC, 1.6% for developing oil exporters, and 1.2% for oil importing countries. None of the three country groups would recover to income level back in 2019, which is shown as the horizontal line of 1. And if we compare the distance between the dotted lines and the solid lines with matching color, we can see that the cost to the income level is 8 percentage points for GCC, 3% for developing oil exporters, and almost 9 percentage points for developing oil importing countries. During this unprecedented pandemic, we believe that testing capacity is a crucial part of the health surveillance that is essential to disease prevention and response, at least at the beginning of the pandemic. So this figure shows the partial correlation between COVID positivity rates and the macroeconomic costs of the pandemic in 2020, which is proxied by the difference between pre-pandemic growth forecast and the current estimates of GDP growth rates for 2020. Let's take a look at MENA before pandemic happens. Lackluster economic reforms in the decade prior to COVID left a legacy of large public sector and high public debt that effectively crowded out investments in social services such as public health. This is what the report calls syndrome fiscal myopia. So in the left-hand side chart, despite a need to transition to market economies, the public sector's role instead expanded after 2011 for MENA region. To document the region's truncated economic transition, this report uses government expenditure as a share of total GDP as the proxy indicator to represent the size of the public sector's economic footprint. And MENA is the only one of the world's region where government expenditure as a share of GDP grew substantially from 2009 to 2019. On the right-hand side chart, it shows that in MENA, spending on health is overshadowed by large public sector wage bills. For all MENA countries with available data, the ratios of government health expenditure to public wage expenditure are below those of other countries with similar income. In addition, what matters is how and how well money is spent. Yet the data show that fewer resources are devoted to preventive health and building a health system. Data for 65 countries, including 3 in MENA, show that preventive healthcare expenditure as a share of general government expenditure in these 3 MENA countries is lower than in the other income peers in the sample. That's what you can see on the left-hand side. And on the right-hand side, you can see that spending is also lower for government administrative healthcare expenditure as a percentage of general government expenditure, but to a lesser extent. The lack of budget flexibility prevents governments from assuming the costs of providing healthcare and shifts health spending to patients who must pay out of pocket. Out-of-pocket spending, or what we call OOPS, accounts for a major portion of health spending in many middle-income and low-income MENA countries, as you can see on the chart. Demographically, before the pandemic happens, all GCC countries except for UAE and more than half of non-GCC countries had higher fertility rates than their income peers in 2019. Data from UN World Population Prospects show that the fertility rate dynamics in many countries of the region changed from years of continued declines to a sudden increase in the late 2000s and early 2010s. Rising or atypically high fertility rates generated a youth population bulge that masked the region's comparatively poor health. The rising in number of youth in MENA during the 10 years before the pandemic created a statistical illusion of a healthy population. MENA's deaths from NCDs per 100,000 people are shown in 2 charts here. Left-hand side plots NCD deaths per 100,000 people against the GDP per capita in 2009. And the difference of the chart on the right-hand side is that the right-hand side chart is after age standardization, which assumes that age groups have the same representation in all countries of the world. In panel A, it appears that MENA countries had fewer deaths from NCDs than did their peers in 2019. But it is a statistical illusion due entirely to the age composition effect. In panel B, after adjusting for age of the population, almost all MENA countries have a greater than expected number of deaths from NCDs. To further explore MENA countries' pre-COVID-19 pandemic preparedness, the analysis of this report relies on data from 2 existing indices of health security robustness. The first one is the Global Health Security Index, GHSI, which is conducted by objective external evaluators. And the second relies on a self-reported assessment by individual countries, the State Parties Self-Assessment Annual Reporting, SPA. To construct a resilience framework for MENA countries, the GHSI data and SPA data are adapted to provide a metric of MENA's public health system's ability to absorb a shock prior to 2020. The 4 pillars that we constructed derived from those indicators are surveillance capacities, information sharing, health system capacity, and regular planning and readiness exercise. So each country's scores are then economically benchmarked against other countries at similar levels of development. Numbers in panel A show deviations from predicted values normalized by standard deviations using GHSI data, and then color-coded to show deviations if it's below, among, or above 33% confidence interval. Similarly, numbers in panel B show color-coded standard deviation from predictions using SPAR data, and panel C shows the difference between the two tables. As you can see in panel A, of the 19 MENA countries across 4 areas of preparedness, MENA countries' GHSI data consistently underperformed their income level benchmarks. Every country except Jordan has at least one pillar in which it underperformed the peers, and only Jordan and Morocco have 3 pillars in which they outperform the peers. And in panel B, by contrast, only 6 of 15 countries gave themselves low enough ratings to show that they were underperforming. Egypt and Morocco rate themselves as outperforming their peers in all 4 pillars. The UAE, Algeria, Tunisia, and Iraq believe that they would outperform their peers in 3 of the 4 pillars. And in panel C, you can see that the table documents the region's tendency toward overconfidence by showing the differences between the objective assessment and the self-assessment of the region's public health system preparedness. In 41 of the 60 cells, MENA countries displayed overconfidence in 41 of them. COVID-19 is more like a stress test to their health systems. Admittedly, the stress test triggered by the pandemic has not yet produced firm conclusions on the resilience of the health system. However, it seems clear that the limited resilience of the healthcare workforce and the supply of medical products and technologies have already caused critical bottlenecks. The WHO Pulse survey found that 53% of the WHO Eastern Mediterranean Regional Office countries reported disruptions in the delivery of healthcare service because not enough staff were available. How to measure this overwhelmed health system? One widely considered objective indicator of deaths caused by COVID-19 is the excess mortality, the number of deaths from all causes above the expected number of deaths during a specific period. All-cause mortality includes reported COVID deaths, unknown or unreported COVID deaths, and other deaths, whether from disease, accidents, or something else. The excess mortality measure has long been used to estimate the death toll of pandemics and other extreme events. So the figure you see shows rising excess mortality in selected MENA countries. How much is this measure of excess mortality compared to countries' reported COVID death? Karlinski and Kobach use excess mortality as a proxy of death from COVID, particularly for countries whose official data of COVID is incomplete. They use this data to calculate the undercount ratio. That's what you can see in the table on the right-hand side. The undercount ratio relates excess mortality to reported COVID-19 deaths. Our table presents the undercount ratios for 6 MENA countries with available data. The undercount ratios for most MENA countries were below 3, except for Egypt, who has one of the world's highest excess morbidity rates relative to official COVID-19 cases in the world. The ratio for Egypt is 13.1. The large number of deaths, the even larger number of serious infections, and the disruptions to the economy, healthcare system, and private lives presented public leaders with an emergency they had to respond to. Both the overconfident assessment of health system preparedness and the unaccounted COVID deaths reveal lack of data transparency in MENA for public health. Overhauling data systems as part of health systems had shown is an urgent area for actions for the MENA region, and high quality, reliable, and timely data is much needed for the region. Building resilience and effective health systems in MENA is a comprehensive task, yet what is common across MENA countries is the lack of reliable, high-quality digital data. So we try to document the difficulty of finding and accessing commonly used indicators to assess pandemic response of countries in the region. We researched the availability of 9 indicators related to COVID-19 across 18 MENA countries. The selected indicators provide basic information about key aspects of public health and about the conditions facing frontline health workers during the pandemic. This figure shows the availability of indicators by country, and this figure shows availability across countries for each indicator. The data were found to be publicly available only about half of the time in MENA. Sometimes data were collected, but not publicly available. In many cases, it was not possible to say for sure whether the data was or was not available. This shows that even if data is collected, it is often difficult to find and access. We learned that MENA countries were overconfident about preparedness of their public health systems. And we learned that prior to the pandemic, 3 long-term trends undermined growth and made MENA ill-prepared for health system shocks. Economic-wise, we saw large public sectors crowding out of investment in social services, for example, healthcare. Demographic-wise, we saw high fertility rates, and epidemiological-wise, we saw high incidence of non-communicable diseases, which is worrisome. During the COVID, it shows the weakness and ill-preparedness of the health system. It also illustrated the relevance and benefits of data systems. So our policy implication include, we suggest improved availability and use of data, which can lead to facilitate appropriate planning and preparedness for regular and emergency healthcare. I'll stop here. I hope I didn't use too much time. Thank you.
No, not at all. Thank you very much, Rachel. Actually, you have shown that you are well used to the discipline and tight deadlines Roberta was mentioning before, because you have used exactly 20 minutes. So thank you very much. I will now, your presentation very clearly presented the main messages of the report and the main message of warning, I would say, about the preparedness of health systems in the region. And now I give the floor one after the other to the 3 discussants. For a first round of discussion, please keep it to 5 minutes each now, and then we will give the opportunity to Rachel and to her to answer to your comments, and then you will have a second round of comments for 3-4 more minutes. So let's start by Mohammed Hamdawi of Trends Research and Advisory. The floor is yours, Mohammed.
Thank you very much for the invitation. The Policy Center for the New South, the invitation.
No,
it's great that this
it doesn't come across well, Mohammed.
Oh, sorry.
Maybe you can put it louder.
Can you hear me now?
Yeah, and speak closer to the computer.
Okay, let me do that. Sorry, I tested it before the event was working just fine. Is it better now? Okay, perfect.
It's better, go ahead.
Very good, thank you. I just want to thank the Policy Center for the New South for the invitation. This is my first event after taking a break and moving from the UAE to the US. And I am a Moroccan national, so this is very close to my heart, and I have followed the MENA region very closely, be it from an extractive industry perspective. So if I'm not a true economist in the purest sense of the word, but I do follow the region, and I enjoy reading the report from the World Bank. I use it as a source of a lot of macro information because we don't have the ability at Trends to run our own macroeconomic scenarios and come up with GDP forecasts. So we use a lot of sources of information. It's going to be tricky to do all the comments in 5 minutes. I think the report, for me, highlighted what probably a lot of people know about the region, the lack the lack of investment in a lot of sectors, including the medical sector, the health sector, and the education, for instance, which are the two that were impacted or had a bigger impact on our daily lives. So that's something that all the countries suffer from. The other one is the issue around demographic, and I think I just hope that despite the lack of transparency in the data, I hope that the policymakers, because they have access to that data, are taking that into consideration and not being kind of blindsided by the misleading statistics. The other thing I wanted to know or to raise is that whenever I looked at the MENA region, I always find it difficult to come up with coherent conclusion across the vast region, because you have the GCC countries whose economies are completely different than, let's say, the North African countries. The dependency on oil and gas is heavy in those countries. But I think one thing that probably we needed to clarify or maybe stress is the fact that those countries have gone through diversification efforts for quite some time now, driven mainly by the oil crisis in 2008 and 2009. And we've seen like countries, some maybe Qatar and the UAE have been much better in terms of diversification of their economies and reducing the dependency on oil for their economies, while others are still heavily dependent, and hence their budgets and government spending is directly linked to the commodity markets and mainly oil. The other thing, or the other observation for me is the fact that the response to COVID has been different in this country. So countries, let's say in North Africa, that structurally are the same, they have the same kind of underlying issues, have responded quite differently to the pandemic. And I'm not going to pick on any individual country, but you look at the story in Morocco in terms of the political will to make sure that testing is available, that vaccination is available early in the process, is complete different dynamic than our neighbors to the east. So the question is, why is that? If you have countries that are struggling with the same underlying issues, have responded differently and have had quite different level of success in addressing the pandemic. The other thing is for me, it's maybe the looking forward. The report talks a lot about the model and the development model that these countries relied on in terms of heavy spending from the government on infrastructure and other things. And I think that's maybe a question for during the discussion is when you see that the MENA region is the only region that increased government spending from 2009 to 2019, I was wondering whether that's actually biased towards more the GCC countries who have spent and increased a lot, their spending post the 2008 oil crisis and eventually post the 2014 oil crisis, where they started adjusting their spending and increasing a lot of social services to their citizens. And the last point, and I'm not sure, I don't want to take a lot of the time, maybe conversation, is that the future or recommendation for these countries. I mean, some countries seems to have taken this opportunity to kind of take a step back, look at what they're doing, look at the best approach going forward, look at their policies and the development model. You have kind of a revision of the vision 2030 or 2040 for some of the GCC countries. You have Morocco who's talking about a new development model that addresses these issues. I think the focus, the question for these countries is, are we going to take this opportunity and look at the silver lining and understand what's important in terms of government spending, what's important in terms of getting the right industries, renewable technology, benefit from the location of the region as a, in the center of the world, close to Europe, in kind of a corridor between Asia and the US, and focus on supply chain resiliency. I have a lot of other points, but I'm just going to stop here for the sake of time.
Thank you very much, Mohammed. You will have opportunity later to bring up other points. I go on now to Leila Baghdadi, who is professor of economics at the University in Tunis and member of the board of governors of the central bank here in Tunisia. Leila, the floor is yours.
Thank you very much, Ivan. Thank you. Thanks to Roberta and thanks to Rachel for presenting this very interesting and timely report about the health system in the MENA region. Actually, it unveils a paradox in the region. While MENA countries have high level of public expenditure, they have inefficient public health goods that fail to deliver. The author explained this by the fact that actually public expenditure went to public employment rather than public good. And this is for two reasons, just to sum up, because of a demographic peak that resulted in high unemployment, in particular among youth. And second, the private sector was not able to provide enough jobs. The main points that the author are making is that governments themselves were not really aware of that, and they were overconfident about the resilience of their health system. And the authors emphasized the need of having good and reliable data that can help policymakers making the right decisions while building back their system. Reading this report and having read the former reports, just, the idea of the painting is not really nice for MENA. Basically, they are facing a dilemma, especially resource poor and labor rich one, a dilemma of constrained fiscal space and the burden of debt that has accelerated with COVID-19 in one hand, and the need to do major investment in public goods such as health, but also other public provisions, public goods such as education or infrastructure. If we add with this, on top of this, we add the need to create more jobs, we have a dilemma. Actually, if I speak about Tunisia, these issues were present since decades, and they were accelerated now by COVID-19. We are calling this the broken social contracts that were materialized by turmoils and instability, and the need to build back again a new social contract. This provision or the downgrade, the downsizing in public provisions actually began in the 80s, and we're totally invaded now by the pandemic. Then data transparency is certainly needed, as well efforts, it could be a good answer to optimize the system, to help decision makers decide or take the good decision. But what is most importantly, I think, and the point was not really clear within the report, what is important is having reliable data to make providers accountable also to beneficiaries. And building back, trying to think again about this new social contract. Then the post-COVID-19 challenges are huge, and this is one question I would like to ask, not totally directed with this report, but this is, the painting I had from the regions, what to do now, having at the same time a big debt, and at the same time, it's really clear now that you need to build back again, and you need again the state. How to deal with that? This is my first question. Here I'm asking, and I hope I can have even small answers. Second, countries like Tunisia, for instance, from one of the reasons where the impact of COVID-19 was really huge, it's the inability to access to essential goods, to COVID-19 goods and medical goods. And this was also due to export restrictions from other countries. The fact that it were not possible to coordinate with other countries and to access to these very important goods. And we had a toll in terms of debt in the country. Also, the inability to produce these essential goods within the country or even within the region. And this is really important. It's not only in terms of health provision or health public goods, but also the capacity to produce within your own resources, with your own resources, important goods to alleviate death. This is second remark. The third remark, then what we should do now? Should we consider health hub among the regions to share information, to share health, best practices? What other countries did? What Asian countries did, for instance, just to understand what we could do as MENA now that we know that we're not really resilient. And also, and certainly, again, not only about provisions in terms of public goods, but what to do in terms of production of essential goods and accessing to these goods outside our borders. Thank you very much.
Thank you very much, Leila, also for sticking to the 5 minutes in this first round, and also for your questions. We welcome Karim El Ainawi, who is the Executive President of the Policy Center for the New South, and has actually been there since the beginning of the presentation, but has now joined us in live, and he will make the final remarks at the end of the presentation. And now we go on to Yuri Dadush, who is the Senior Fellow of the Policy Center for the New South, who will make his comments. Having been inside the bank, probably he's well aware of the stakes and the difficulties of producing such a product, such a report. Yuri, 5 minutes, please.
Yeah, thank you very much, and thank you, Roberta and Rachel, for your work, for your dedication. The report is timely, obviously, and deals with a critical subject. It contains many interesting insights. I learned quite a bit. There's a lot of interesting data there, and it has important policy messages. But in my view, there are some weaknesses in the report, which I will highlight, partly in retribution for all the reports that I presented when I was at the World Bank, and where outside commentators who have no idea of how much work it takes express their views. Sometimes, you get revenge. Anyway, there are three. First of all, I want to say I thought the most powerful and convincing policy message was about the importance of comprehensive data coverage and transparency. In Morocco, about half the main indicators required to monitor and deal with the pandemic are either not collected or they're collected and not made public. I found that data series, which I understand is new due to your research, to be absolutely fundamental, and all the policymakers in the region should look at that. I also found very helpful the distribution of health spending out of pocket by government, et cetera, et cetera. That was also something. I mean, I don't know, I'm not a health expert, but for me it was very, very instructive, again, to see that in Morocco, a lot of the spending on health is out of pocket. One example coming from my work on the importance of data, in the case of Morocco, we couldn't find mortality rates. So we couldn't calculate the excess mortality in the work that I did with Umayma Bourghiba, which is on the policy center side. By the way, in that work, we found a strong correlation between undercounting deaths and governance indicators, okay? But we don't know what the situation is in Morocco. That's on the positive side. Now my three critiques. One is I really missed a comparison of how MENA did on the pandemic with other countries. There are a lot of comparisons with other countries, but no in-depth analysis to at least try and document the point that MENA did not do well. I mean, I was reading the slides, and of course I read the report, and I said, well, many of these things could be applied to every other country I'm familiar with. How about the United States for being overconfident, okay? And so I missed that. Why not make a systematic effort to look at the data and compare and try to demonstrate did MENA did better or worse? I don't know at this point. And you do make an effort to say that the data is bad, that there is undercount, etc., but there's no comparison with other places really that we can use to say things were worse here. And so that remains open. The second critique I have is there's too much assertion in the report, in particular with regard to MENA is spending too much and not spending enough on health. I'm ready to believe it, okay? I'm familiar with the reaction to the Arab Spring and all that, etc. But if you're gonna make those statements, we should have some documentation, some arguments, some data that shows that we're overspending and we are underspending on health compared to education, compared to infrastructure. There are many other needs in these countries, as you know only too well. And the third is, of course, coming from me, you would expect it. I found the macro section quite disappointing because there are many issues, structural issues, which I don't want the IMF only to deal with. Structural issues about what are the implications of debt, what are the implications for economic structure of the changes in demand, what are the implications for trade and global value chains of the pandemic. These issues are really not touched upon. So that's it. But overall, you know, I learned a lot from the report, and I hope that the bank's team will delve deeper into some of the issues which I have highlighted.
Thank you very, very much, Yuri. I think the three of you have produced a whole agenda for the new MENA economic update in 5 months, actually. So good luck. Maybe you, Roberta, or or Rachel, you want to react on some of these comments, in some cases, some questions like Leila did? Please go ahead. Any of the three of you.
Thank you. Kick it off, or Rachel, please go ahead.
Okay, maybe I can try to start, and then Roberta and Ha can come in case I missed anything. So first of all, thank you so much, Mohammed, Laila, and Huri, for your insightful comments. These are all very helpful. So let me start with Mohammed's comments. It's a very good point that MENA region are quite diversified, from GCC countries to developing countries, and to countries that, for example, in developing oil exporters and developing oil importers. And this is exactly why we try to discuss in almost each section of the analysis by country groups to start with. For example, we in the chart that we show about OOPS, out-of-pocket purchase, we list for all countries and we group them by GCC and non-GCC. And in our comparisons, we always benchmark with the income level so that a low-income country will not be compared with a high-income country. And Mohammed has also mentioned the effect of oil price to oil exporters and oil importers to the region. We completely agree. And in this report, we have also shown that the econometric evidence from a global sample of countries, which shows a positive export price shock lifts GDP growth on average, while import price shocks do not seem to affect GDP growth significantly. But the situation appears to be different in MENA, where positive and negative commodity price shocks have larger impacts on growth than in the rest of the world. So you can see it in more details in the report. Mohammed had also mentioned about the rising in the government expenditure and the rising in health spending in MENA. So with the data that we have available, we can see that admittedly GCC had a high increase in the health spending, but we also see Egypt and Jordan are all, in terms of health spending, Egypt and Jordan are also well below the predicted value. And it comes to Layla's comments. First of all, it's great to see you, Layla, on a different front. Layla and I are working very closely together in building the first annual conference of a regional research network of the central banks in MENA. And thank you, Layla, for sharing the firsthand context of Tunisia's experience in building back. And Layla also mentioned about the debt issue, which is mentioned by multiple discussants. So we also agree that the region's debt burden continues to be one of the major concerns in the region. We analyzed this issue in our April 2021 report, which is titled Living with Debt. So I will not spend much time on it, but we believe that the substantial borrowing that MENA government had to incur to finance essential health and social protection measures boosted government debt dramatically. And we also have data specifically to help analyze this issue. And to Huri's comments, thank you very much to share with us your research experience with a strong connection to Morocco. This also strengthened our beliefs of necessity of data transparency. So thank you for that. And for your questions about we didn't say specifically that MENA did worse than elsewhere. This is because our report is trying to be humble about the uncertainty of the pandemic and about what we do not know about. Our report says in Chapter 6 that many questions are unanswered by the de facto stress test, either because it is too soon to tell or because data collection has not been sufficient. Even today, you never know what will happen tomorrow. Are we at the end of the pandemic? Nobody can say for sure. And MENA's health system was underprepared, but also overconfident before the pandemic. In each of the analyses, we strive to compare MENA with income peers. And to the second question from Huri, that we didn't say that increased government expenditure in MENA is bad. Because we believe that increasing government expenditure is not necessarily a bad thing, of course, provided that debt is not a concern. What we argue here is that government expenditure might not be well spent. A large share of expenditure in MENA is on public wage bill, a phenomenon we phrase fiscal myopia. Large public wage bill hampers investment on public health, which we well documented in our report, and potentially education infrastructure, which we did not focus in our report. And lastly, the reason that we didn't spend too much chapters about on the macro side is because I also mentioned previously that this report is specifically focused on health. And in the April MENA Economic Update, we had focused examining the impact of COVID-19 on public debt and provides a thorough policy discussions on fiscal policy and public debt during and after the pandemic. And in the October 2020 MENA Economic Update, that report examines regional trade integration, global value chain before and during the pandemic, and provide policy discussions to increase regional integration. But we promise that we will do a better job next time in linking with the previous reports in our future work. I'll stop here. Thank you.
Thank you very much, Rachel, with the promise included. Roberta, you wanted to add something.
Actually, let me turn to Ha first, if you wanted to add something to Rachel's very thorough answers, and then I'm happy to come in with my 2 cents.
Huh?
Thank you, Yvonne. Thank you, Roberta. No, I don't have much to add. I think Rachel provided a very, very clear and comprehensive answer. I just would like to emphasize, to reiterate that we don't have a crystal ball of what the current situations. I think it's still fluid. We're not out of the wood yet. Many countries were praised for very good response. Turns out that a few months later they were overwhelmed with COVID. Take my own country, Vietnam, for example. Vietnam was heralded as the sample of the world, a good example of the world in the beginning of COVID, but then Delta overwhelmed the health system a short 6 months later. So I think in that sense, there's many other factors in addition to health preparedness that could affect the country's performance during COVID. Jury mentioned the US as a very clear case. So instead, we decide to focus on the health system preparedness before the pandemic. I think that's something we can talk about. We have evidence. Hopefully we presented a good case, and I think it's fair to say that health system preparedness is a necessary condition for a good response. It's not sufficient condition. So it's just a necessary condition. And I think I would like to go back to later questions about the region, right? And many of us here have been thinking about the regions for decades. So I'm all ears to hear about what we do now. So, the region is facing a lot of challenges, and the urgent energy transitions that the world has to do to avoid catastrophic environmental disaster. We even put many MENA exporters in much more difficult path. And we're talking about 2 decades from here that the world, by mid-century, a lot of countries we have the net zero carbon emissions. So what MENA exporters will do about it? And I like hopefully that our esteemed panelists who have been thinking a lot about MENA regions and who have some ideas. The World Bank also have some ideas too, and we lay out some of our ideas in different MENA updates, and I will share the link with everyone right now. So I stop here. Over to you, Roberta.
Roberta, thank you very much.
Thank you, Ha, and thank you, Ivan. And the first thing that I wanted to say is that I should count myself very lucky because I have a fantastic team here, Rachel and Ha, and also the whole team who produced the report that leaves me very little to add. So I'll just share a couple of reflections on these very good comments. I took copious notes and they will stay with us as we think about, as we're producing already, the new update. So first I wanted to reflect on something that Mohammed brought up, which was like, what are we talking about when we say the region? And of course, there is so much heterogeneity in MENA, ranging from Yemen to Qatar. Then when we say the region, what do we mean? And when we think about health, for sure we see in the performance of health system dramatic differences. And we all know the ones from the health trackers in terms of both testing and the rollout of the vaccination, which was, of course, the highest in the richest countries, but it was also extraordinarily fast in Morocco. At the same time, there were other middle-income countries where the rollout was not that fast. And there are the fragile countries where the share of the vaccinated is very low, and some of these countries do not even report anymore their positivity rate. So the range is probably as wide as the range in the world. Sometimes also, if we look at them, and here I'm thinking about Uri's statement about how do I know that we're spending enough in health? Are we spending too little, too much? What are we doing? So the only way that we found convincing and simple, this is a simple report, is not a report that delves into dramatic depth, but at the same time, we want it to be rigorous. We want it to make sense, to sort of give a sense of comparison without judging, was to present everything in terms of residuals. So we take as comparison the typical comparator vis-a-vis GDP per capita. So what you see in most graphs and figures are not the actual values, but they are the residuals once you clean out from the effect of GDP per capita. So essentially the deviation from where you would expect that country to be once you control for what, the variable that probably accounts for most of the variation of why countries are very different in the world. So that's one way in which we try to handle in a sort of balanced way the question of comparisons. Now, I just want to give an example of where being rich really matters. And it's not only in terms of the rollout of the vaccines or the testing. Clearly, GCC countries had an ability to sort of be, they powerful negotiators. They had the funds to secure supplies and so on. But also, if we compare Oman to, let's say, Egypt, we see two health systems where in Oman, the out-of-pocket expenditure of people are in the single digit, where I believe in Egypt, they are about 60% of total health spending. So I was actually in the same camp as Uri when I saw these numbers. I was actually quite shocked because the fact that I don't know whether these countries are spending too much or too little, but I know that they're shifting the burden of health and the risk of health onto individuals. And I know that this is costly and inefficient. Inefficient because the government, through the pot of tax revenues, can share the risk across the population. And costly because it sort of fragments the purchasing power, sorry to make it so as if it were a market, across many individuals, instead of being able to sort of bargain down costs. So something is happening in these health systems where families and households face a real risk of being impoverished by catastrophic health spending. And we know that when you have this risk, you tend to reduce the consumption of health services. And what is the consumption that you reduce the most? Preventive care. And what do we do? What do we know for the treatment and the management of non-communicable diseases? That the most important things are preventive care, our lifestyle, are the type of medication that help you manage towards a long and healthy life. So we don't come up with a magic number of what would be, a country should spend 4% of GDP, 3% of GDP, 5% of GDP. But we try to use, as Hao was saying, a framework of resilience to think about the pandemic as one tremendous stress test, which we know is not going to be the last. Climate change is shocking the system in its own way. Future pandemics might come. So instead of sort of thinking about, did we do well or did we do poorly? We're thinking about, are the systems best placed to react in the best possible way once the shock comes? And I was pleased that you all focused on the question, the importance of data, and you highlighted different angles of why data matter. Leila brought up both the fact that essentially data saves lives. So should countries share information and knowledge? Should the government share information and knowledge about the, where the hotspots of the diseases are, so that people can even regulate their own private mobility or decisions vis-a-vis whether it's more or less dangerous for them to do so. Somehow you hinted at the question of targeting, having the information allows you to target the spending where it's more efficient. And also Leila brought up this very good notion, which we didn't even touch upon in the report, and that we hope we can bring up in the future, of how important data transparency are for accountability, to research or short circuit the long route to accountability from the user, the provider, the politician who appoints the provider and who's then voted in and voted out of office, in a way so that users can actually have the information about performance of their providers and can react to that information with agency. I confess that I share Uri's, I'll conclude now. I confess that I share Uri's dissatisfaction with how much we were able to do on the macro side. This is very close to the fact that we work on a tight timeline of receiving the country forecasts about a week before we have to go to the translators for the report to be able to issue the report for the annual meetings and the spring meetings. I'm just being very honest. In a way, the process is something that shortchanges an analysis that definitely deserves more. Fortunately, we're serial offenders. And so like Rachel said, last issue was devoted to the debt, to managing the debt. And I do think that those messages from our work on living with debt are still valuable now. And talking about data transparency, our next semi-annual update will be on how effective we are at forecasting. So it will be all about the macro, and it will be a reality check for all of us, the bank, the fund, and those who are in the business of making forecasts, to really understand, do we get it right on average? Are we biased in some ways? There's something that explains that. What is the role of data? I wanted to conclude with the sort of, once upon a time, we would have said $1 million question. Now probably should say $1 trillion question, which is, what should country do now, which Leila raised? I don't think I have the $1 trillion answer to this. But what I can say is that something that we try to highlight here is rather cheap. So investing in data, being open about data, and in establishing a relationship of trust and openness with the citizens, where the government can say, yeah, this doesn't work out, but we're monitoring, we're following it up, we're trying our best to make it work. That comes, that is priceless and also cheap. So I can't say what countries should identify as the trade-off between health, education, and so on. For sure, right now, till we're out of the pandemic, investing in these public core health functions will be essential, because the causality will go from that to getting out of the pandemic and to an inclusive recovery. So thank you for this first round of comments, and we look forward to the second.
Thank you very much. Before going, we have 10 minutes before the final remarks. I will give the floor for a quick second and last round to the three discussants if they want to raise any additional issue to react. I will make myself, using the privilege of the moderator, just one suggestion. Since you have been putting the focus on data transparency, and you have come up with this very interesting, I agree with Yuri, indicators on availability of information across different countries on 9 different indicators, you should eventually think about perpetuating this exercise so that you give some incentives to countries to improve. And you do not only name and blame, which is very good to start with, but also incentivize them to improve over time. Because I'm sure in many of these cases, it is not even an issue of a political decision, in many cases, to hide information. It is an issue of governance very often. So with proper incentives, they might open up, and this would be a public good for all of us. I stop there. I don't want to use too much of my privilege. And I will change the order now. I will start with Leila, then Mohammed, and then Yuri. Then if you want anything from the bank, and we will give the floor to Karim. So Leila first.
Thank you very much, Ivan. Actually, Rachel and Roberta answered all my comments, so then I have absolutely nothing to add. Only, I agree with you, just to be good to try and follow up with this work to see how things are going for these countries, for our countries in the region, and if there are some improvements. Then I'll pass my turn. Thank you.
Thank you very much, Leila. Mohammed?
Thank you very much, Ivan. Can you hear me now? Thank you very much for your answers. I think for me, it's the challenge probably, as Yuri and Roberta said, is around the spending in the healthcare. It's probably not about how much you're going to spend, because we did a lot of analysis last year. We looked at, for instance, Germany and France tend to spend the same percentage of their GDP on healthcare. But if you look at the response up to kind of the full 2020, two complete different scenarios. So it's not just about the spending, it's about the signal and effect of leadership. It's about the approach. It's about the trust you put into your primary care provider at the local level. It's kind of a nice mix between the private and the public sector. So I think the big question maybe for the region is not increasing the absolute number of capital on healthcare and maybe focus more on less on the employment, but also what approach are you going to have for the healthcare? In Morocco, a lot of people spend a lot of money out of pocket to go and get medical attention. You go to the concept of primary care physician doesn't exist, maybe only in certain urban areas and people tend to sometimes forget to file the paperwork to get insurance to refund their out of pocket because the process is very cumbersome. And I close with this. I think data is crucial to whatever we do. I mean, if policymakers, if they are not providing that data freely to think tanks, analysts, the public, they are losing in terms of losing a lot of potential gray matter that can analyze the data and provide policy suggestions. And then the big question is, the $1 trillion question is, what do the Middle East and North African countries do in the future? I think we're seeing a lot of good positive indicators in terms of questioning the role of the government, questioning the size of the government, which industries to focus on, and even the development model. So, the silver lining is that, as I said, maybe this is the opportunity for people to take a step back and think of better ways to do business in the future.
Thank you very much, Mohammed. And then Yuri, your last thoughts?
Yeah, just very quickly, I agree with Mohammed. In the US, we spend 18% of GDP on healthcare, GDP, on a GDP per capita, which is much, much bigger than anybody else's. That's, I think in Morocco, it's 7% of GDP is spent on healthcare. I know a bit about Morocco. I know a lot about the US. I would be ready to argue that Morocco has managed the pandemic better than the United States, just to underline the point that it really isn't mainly about spending or the size of the sector or anything like that. A lot of it has to do with information, organization, political cohesion, responsibility of the policymakers, et cetera, et cetera. And I hope the bank will focus more on those soft aspects and less on the kind of financial numbers.
Thank you very much, Yuri. Then maybe a final word by Rachel and by Roberta, and then we give the floor to Karim. Rachel?
Thank you so much. I agree that just to comment on Huri's last insight, that we agree spending is not the only story that we want to tell. There are many fronts that can help affect the performance during the COVID. For example, the political leadership. And on that front, I think we're on the same page. And if I may, I just want to take this last opportunity to thank the Policy Center for inviting us. And I'm impressed of how professional and well organized this event is. And thank you, Ivan, for being such a good moderator. And thank you, Laila, Mohammed, and Huri for all your insightful comments, which might contribute to our future economic updates. Thank you so much.
Thank you, Rachel. Roberta, final word?
Final word is thank you, of course, because this was great food for thought and a very kind and very pleasant conversation. I also wanted to pick up where Uri left it. I don't want it to be misunderstood that we say, oh, you should spend more on health, but of course it's how you spend it and what you do with it. But there are certain functions like disease surveillance that have been left forgotten for years and years. And on those, I think more spending and more attention is needed. Let me just use this last 30 seconds to actually put a quick ad for the collaboration that we're having with Leila, the Central Bank of Tunisia, the Central Bank of Morocco, and a newly constituted network of central banks with the first annual Central Bank Conference on Development Economics in MENA, which is coming up on December 1st and December 2nd. It's our first activity joint as a network, and we thank the Central Bank of Tunisia for being the future host. We will have a very interesting collection of papers submitted from all over the world, and also Carmen Reinhard as our keynote speaker. So stay tuned, and I hope that we'll see you all in December to the conference. So many thanks on my side.
Thank you very much, Roberta. And then I'm sure that we are going to go back to substance somehow, to the extent that I know Karim. So Karim will make the final remarks. He's the executive president of the Policy Center for the New South, and he happens to know well the World Bank as well. So Karim, the closing remarks are yours.
Thank you, Ivan. Good afternoon to all of you. It's a pleasure to be with you. Thank you for this discussion. I'm very glad that our partnership with the bank, the World Bank, is continuing this way. We have opened many streams of discussion, including on trade, on the environment, on the impact of COVID on various sectors, etc. So I want also to commend the authors of the report for the excellent piece of analytical work. I think it provides useful information. It's also full of interesting ideas. In my concluding remarks, just to avoid to come back on the good points that were made by all the speakers, I wanted to focus on a couple of things, and particularly give you a flavor on how we see the current times and how we see the medium-term, outlook, how we perceive it when we discuss here with policymakers, beyond Morocco, but also in the region as a whole. And this is linked to one of the points that Uri has made. I think let's not forget that this crisis has been a challenge to internal fronts in societies, in political terms, of course, but also on the social cohesion, on the social fabric of many countries. And this has shown that the solidity of internal fronts, the institutional capacity of states to respond, the capacity to provide protection is fundamental. And it goes beyond just spendings. I mean, it is about institutions, capacity, knowledge, the combination, the interaction between actors. This is institutional development. In the end, this is what development is about. And this goes beyond the short-term macroeconomic management, through the cycle. I mean, that's a different thing. And I think many of the outcome, Roberta, that you're seeing in the region are coming from that. I would say it's different to pour water in the sea, to pour water in the sand, or to pour water in a glass. So it's a little bit the story that you have there. Well, of course, understand that in some countries where you have open conflicts, let's say Libya or others, that responding to the crisis, whatever you spend, is a different story. I mean, that's, I think, something that is very obvious to political scientists, but when we use economic tools, it can be there. But that's the first point. And I think health ministries should build their capacity, but it's beyond that is how you can deliver specific and targeted services, social safety nets to populations at the local level, in the neighborhood, in their houses. That's what we are talking about. And I think Morocco is doing quite well. I don't want to sound biased or extremely positive, but the numbers are there. I mean, the country now is vaccinating people for their third dose. We're talking more than 3 million people. I mean, if you take people over 30 years old, it might be that we have vaccinated 75% of the population, and maybe 60% in general. So, and I think that's an important lesson. The second lesson, I think it's about fiscal policy that I would draw. I think the budget in many of these countries is a fundamental tool in the economic, but also the social regulation, as we know, and everywhere in the world. And actually, the current discussion in the US on the infrastructure bill shows that the budget is the sounding bell of all political tensions in a country. It's an eminently political instrument that's where you sort of negotiate. As a government your priorities, but you have also a parliament, etc. And most of those countries actually, whatever is the kind of political arrangement they have, it is true that the budget and the fiscal policy is fundamentally linked to the internal equilibriums of country and political arbitrages. And I wanted to recommend something to our friends at the World Bank. I mean, there was at my time, I don't know, I'm not that old, but still, there was a fantastic product of the World Bank. It was called Public Expenditure Reviews. I don't understand why we're not doing any. I mean, this is an extremely useful tool to structurally understand the budget, the fiscal spending, and how it goes and its efficiency. And with all the progress we have made, in analyzing and linking macro and micro data using micro simulation, linking household surveys and macro numbers, etc. I think there is something to be done in terms of how do we spend, how efficiently it is spent, by region, etc., categories of populations. And this is my third point, which is the nexus between science and the art. The art of policymaking, which is an art. This is not a science for many reasons. And I think there's a lot to be done. I mean, most of our countries have sort of organized the council of, a health council of eminent personalities linking to decisions and looking at what kind of decision the government, advising governments, I would say. But we need to go beyond. And this is your point that I think many of you have insisted in the discussion about the central role of data and open data. I mean, there's no social sciences and economics, which is in the end also a social science, without data and observation and experiments, etc. So that's, I think, will remain a fundamental point. We need better data, we need more science, we need more imbrication and nesting between academia in general, whether it is universities, but also applied research institutions such as the Policy Center, but many others could bring to the table. I don't want to sound too gloomy, but if I look, and that's my last point, on over the medium term, I think there are serious challenges ahead. Whether we don't want to look at it or not, debt, public debt, will be an issue in many countries. Interest rates are rising, the cost of debt will increase. Inflation, in a way, is already there. It can be a highly sensitive issue in many countries of the region, particularly for basic staples. So I think macroeconomic policy will be under tension. Some inflation, exchange rate depreciation in several countries that have already sort of heightened the inflation pressure, compounded with the higher commodity prices, with stronger pass-through, exchange rate pass-through. So I think there will be a complex balancing act to be made by governments, and all this is taking place in the middle of a recovery. Recovery is also how does it trickle down in jobs, and for the first time in many years, I mean, this crisis has affected informal workers. Usually they were this sort of bumper absorbing shocks through the cycle for households. But because of the nature of this pandemic, informal sector jobs are contact jobs. They are labor intensive. They are, and there is a permanent loss there, I guess, for many. So I think that will remain an important issue. Also, I don't think this is only a short-term story, and I think in your report you alluded to that in many places. There is an underlying, profound transformation ongoing on the global economy that will affect. It's a structural changes that will affect, the international economy and the place of our countries in the region, the place they have in the new organization of value chains, etc. Deep transformation that are not led by states but by companies and firms in general. So where we are, we need to adjust and adapt. And I don't want to sound again too gloomy, but there's also a geopolitical background which is not really easy. You are well aware of the situation in the region, in many countries. But if you add to that, global rivalries at the global level, and there are consequences on the African continent, potential consequences, and a couple of those countries we're talking about. So that's a very complex environment and complex balancing act and complex set of policies to set up for governments. So I would say, in a nutshell, to conclude, challenging times, smaller, tighter margin of maneuvers for many governments, the necessity to keep a solid and functioning institutions and state, and internal stability and internal fronts in a global environment, and that will remain challenging. Last word of conclusion, I don't know if it's your appreciation, but my sense, exchanging with colleagues here, is that we've never fully recovered from the financial crisis in reality. There was a start of a fiscal consolidation process, in 2014-15, but in reality, the scars of the 2008 financial crisis were still there when this COVID crisis hit many countries. So let's not minimize the challenges ahead. Some countries are better prepared than others. I mean, you have mentioned at several occasions that as a region, MENA is covered with lots of varieties. Like when we speak about Africa, 54 countries, there's not necessarily a single story, but they are, it is well shown in the report, they are different, there are common challenges and similar challenges. So again, many thanks. It's been a pleasure to listen to you and to read this report. Looking forward for the next edition and to see you soon, inshallah. Thank you.
Thank you very much, Karim. What is sure is that we will need more data and more analysis. Thank you to the World Bank, the three co-authors of the MENA report. Thank you to the three discussants. And it has been a pleasure to host you at the Policy Center for the New South. Bye-bye. Thank you.